It's about the restoration of our republic. We want to educate, encourage, enable the power. We stand for integrity, honesty, self-reliance, self-defense, and most importantly, no compromise on our foundational principles. This is America's Voice Now.
Find America's Voice Now on Facebook and at americasvoicenow.org. Here's Michael Evans.
Good morning, America. You're listening to America's Voice Now. My name is Michael Evans. I'm your host this morning, as I am every morning. Glad that you're able to join us. Appreciate your attendance. We're going to cover a number of issues this morning. We are going to have a 1-hour show this morning due to some technical issues, and I am going to address a number of issues that we want to try to bring out. First, we are on the eve of D-Day. That is the Obamacare launch that is scheduled to happen on October 1st. We're going to talk a little bit about that and what that means for you. We're also going to talk about the states that there are 10 states where Obamacare is slated to completely wipe out their existing health care plans. And so we're going to address that, take a look at that information, and understand the implications of what that means for the literally millions of Americans that will be affected by that. We're also going to touch on the NSA spying and how it's causing net balkanization, and then also the social connection, which is essentially a Facebook-like application which is being developed by the NSA to add to and build the dossier on every American. You know, we are living in a police state, ladies and gentlemen. I've said it before. You've heard me boldly state the truth. We now live in a police state. Everything that we do is being monitored. And the NSA is doing this with immunity and impunity. And frankly, I think Americans should be outraged. I cannot understand why the outrage from America is not stronger. There's also an article out about Glenn Greenwald. He's the guy who broke the story with Edward Snowden initially, and his take on a new story that he's working on with another representative or another member of the media, in which they're going to blow the doors wide open on a, quote, and this is not my phrase, this is theirs, an assassination program that the NSA has been working on. And so we're going to address that and take a deeper look at that and understand the implications of what that may be, although I don't want to go into conjecture on it because, frankly, you know, until we hear the reality of what that story talks about, I don't want to get into a topic of discussing what may or may not be said in that. But if it's anything like the blockbuster of all the other NSA tyranny we've been hearing about from Edward Snowden, we have to make a clear and concise statement that we cannot continue to allow this to go on. If this information on an assassination program does not awaken the sleeping giant of America, ladies and gentlemen, I fear that nothing will. Okay, we're going to get into our first article of the day. Obama on the eve of the Obamacare debacle. What we have this morning are a series of articles that are out, all in reference to the Senate that has been, over the weekend, for those of you who aren't familiar with what happened, over the weekend, the House passed a new bill, which is essentially a bill that stated that they would fund everything in the federal government, 100% of everything, with one exception. They wanted to defund Obamacare, and they wanted to repeal the section that has a tax on the 2.3% tax on medical devices. And that particular aspect has a significant support by both the Republican and the Democratic side of the House, because everybody has medical device companies within their states or their districts who are clamoring about how painful and how destructive this tax will be. And medical devices, by the way, folks, includes everything from, the basic catheter all the way up to, an electric heart. So I mean, it covers the gamut of anything and everything. Everything is a medical device. If a bandage, an ACE bandage, is a medical device. And so this 2.3% tax that they've levied on all of these items is very, very damaging. And so there is two parts to this bill. They have submitted it to the Senate. The Senate comes into session at 2 o'clock this afternoon. Amazingly enough, they're going to wait until 2 o'clock to actually vote on this. And what they're going to vote on is not the bill. They're going to vote to table the bill. So I got to clarify something for you folks, because you're hearing a lot about how, the Republicans are shutting down government and all of that. Listen, the truth is simply this. There have been a raft of bills that have gone to the Senate from the House, and those bills have all given the Senate numerous and multiple opportunities to attempt to resolve the issue without Obamacare. Any shutdown that does occur is not the result of the House's actions. At this point, they've given the Senate numerous opportunities to step away and to fund the government without the Obamacare issue. Everyone is, I should say, everyone who's not partisan and ideological or owes some allegiance to the Democratic Party and this president are in agreement that there's absolutely no reason why we could not delay the individual portion of this thing for the 1 year and sync it with the requirement that has been waived for corporations. Now, for the record, the exchanges that are supposed to open literally tomorrow, folks, are in absolute chaos. I mean, the reports that are coming out from the individual states, and so you understand how this works. There are, when Obamacare was first implemented or made law, they gave states two options. One, that they could create their own healthcare exchanges and work as a state with their insurance companies that were within that state to resolve the problem. In other words, create a state exchange for state X or state Y or state Z. Now, those states that chose to create the appropriate exchange, they have control over those exchanges. 30 states chose not to create an exchange. And so what that's done is it has placed the onus on the federal government to create federal exchanges for those states. Now, again, we're talking 30 states here, right? And so what we're hearing is that, and this is a statement from John Barrasso, who's a Republican out of Wyoming. And of course, he's a Republican, so you can take it with a grain of salt. But on Sunday, he came out and said that the Obamacare insurance exchanges, which are set to go live tomorrow morning, quote, are being held together right now with duct tape and chicken wire. He's also a doctor. He's a physician. And he was interviewed on Communist News Network State of the Union. And he said that consumers are in for a case of sticker shock. And the reason that they are is because the way that they're developing these exchanges, there's an extraordinarily good likelihood that these exchanges will not have the ability to provide, will not have the ability to provide the doctors and the care that you were accustomed to before. In other words, if you already had insurance, you're likely to lose it. Now, the president made a couple of promises. This is, again, quoting John Barrasso. The president made a couple of promises. One with the exchanges, and he said it would be cheaper than a cell phone bill. And I don't expect a lot of people to be able to find something for less than $71 a month on an exchange. People are going to be paying more. And if you had your, he goes on to quote Barack Obama, if you have your doctor and you like your doctor, you can keep your doctor. We're seeing all across the country exchanges that are trying to get the price down, and as a result, they have had to exclude many doctors. He rattled off a list of states with exchange problems, which included Vermont, Oregon, and the District of Columbia. He goes on to say, this law is unworkable, it's unpopular, it is unaffordable for us as a nation. It's hurting jobs, hurting the economy, and now what I'm hearing, and I was at the health fair in Wyoming yesterday, is that it's unfair. Because people came up to me and asked, why is it that the president is going to give my boss a 1-year delay? The bosses are getting a delay, but the workers are not. And we need a delay in the individual mandate. So, there's another article out there, which is on Daily Caller, and there are 10 states which they point out where Obamacare wipes out the existing health care plans. The first is California. 58,000 will lose their plans under Obamacare. The first bomb dropped in California with a mass exodus from the most populated state's Obamacare exchange. Aetna, the country's largest insurer, left the state in July. In other words, they refused to provide insurance in California. And then they were followed by United Health, which is, I think, the third or fourth largest. Anthem Blue Cross also pulled out of California's Obamacare exchange for small businesses. 54%, ladies and gentlemen, of Californians expect to lose their coverage. 54%. Now, the second state listed is Missouri, my home state. Patients of the state's largest hospital system, and it spans a total of 13 hospitals, including the St. Louis Children's Hospital, will not be covered by the largest insurer on the Obamacare exchange, Anthem Blue Cross Blue Shield. Anthem covers 79,000 patients in Missouri. And as a result, they won't be able to see any doctors in the Blue Cross Blue Shield healthcare system that is run by Anthem, including any of those 13 hospitals. So, in other words, once you have signed up for Obamacare under the state exchange, you will not be able to see any doctors in the BJC healthcare system, or go to any of their hospitals, I might add, and be covered. In Connecticut, Aetna, the third largest insurer in the nation. So there's your answer. Aetna was the third largest. Won't offer insurance in the Obamacare exchange in its own home state. Aetna is based out of Connecticut, and they will not be offering Obamacare in their own state. The reason that they've said is, and this is their statement, this is Aetna's official statement, we believe the modification to the rates filed by Aetna will not allow us to collect enough premiums to cover the cost of the plans and meet the service expectations of our customers. Maryland, 13,000 individuals that are covered by Aetna, and another company which it owns is called Coventry Healthcare. They will not be able to keep their insurance plans if they want Obamacare subsidies on the exchange. Aetna and Coventry canceled plans to offer insurance in the exchange when state officials wouldn't allow them to charge premiums high enough to cover their costs. You see, here's where the rub is coming, folks. There are requirements under Obamacare. And so in order to avoid those requirements, or to avoid, and part of the requirements are that you have to be insured for all kinds of things which you may or may not want. And so they're basically saying this is a one-size-fits-all plan. And when you look at, as an example, a young person who's single, why would they want to buy birth control or health or coverage for maternity and things like that? I mean, yet the reality is that they're not going to allow you to pick and choose the kind of coverage you want. That is, ladies and gentlemen, the loss of free enterprise. And furthermore, it is not capitalism. When you are going to sit there and literally block individuals from being able to acquire the health insurance that they choose to buy because of the fact that you are not allowing them to pick and choose the type of plan they want, I don't know how else you characterize that, except that it would be determined to be socialism, right? I mean, that is essentially where it's at. In South Carolina, 28,000 people who are insured by Medical Mutual of Ohio, South Carolina's second largest insurance company, will lose their coverage because that company decided to leave the state entirely in July due to Obamacare's, quote, vast and quite complex regulations. New York. Aetna pulled out of the New York Exchange in late August in an effort to keep their plans, quote, financially viable. New Jersey. 1.1 million Aetna customers will lose their coverage because the insurer won't be part of the exchange. So if you had Aetna and you lived in New Jersey, my old original stomping grounds, you would lose that policy. Now, that is in direct violation of the president's promise that if you have an insurer you like, if you have a doctor you like, if you have a hospital that you consistently go to, you'll be able to keep that. In Iowa, Wellmark Blue Cross Blue Shield, that's Iowa's largest health insurer. They are deciding not to offer plans in the Obamacare exchange at all. Here's the rub. In Iowa, this one company sells 86% of Iowa's individual health insurance plans. 86%, folks. So basically, only 14% of the people in the state of Iowa will continue to get health insurance from someone other than Wellmark Blue Cross Blue Shield, because they said, look, we're just out of here. We've had enough. There's no way that we can do this. In Wisconsin, 2 of the 3 largest insurers in the state have pulled out and will not offer plans on the exchange. They are United Healthcare and Humana. Now, listen, guys, these are the biggest insurance companies in the nation. In Georgia, 5 insurers are participating in Georgia's Obamacare exchange. Mutual of Ohio left Georgia and Indiana, as well as South Carolina. Aetna, along with Coventry, also has said that they will not offer a service in Georgia. So what you have to realize is this. The largest insurers in the nation are backing out of the Obamacare exchanges, and they're saying, listen, we don't want to be a part of this. And here's where the problem comes from that. This was exactly the goal and the plan. Here's why. As these insurance agencies pull out, the ultimate goal, if you recall what they originally wanted, wasn't Obamacare. It was a single-payer universal health care system where the government was the insurer. And if you listen to what's going on here, this thing hasn't even begun yet, and the largest insurers in the nation are pulling stakes and saying, we're out of here. Now, when they're out of here, what does that mean? That means that they will not participate in the Obamacare exchanges. And that tells you that effectively this administration has configured Obamacare to work in a manner that will allow them to ultimately become the only insurer of choice. There will be only one ultimate insurer. You watch and see. That's the goal here. That's the direction they want to push this. All right. I want to touch on the issue of where this is going to head now, because if today the Senate refuses to even hear the House bill, what they're going to do is send back a bill which funds the government through to November 15th as their continuing resolution. That leaves the House with only a couple of hours to respond ahead of tonight's midnight shutdown deadline. Now, remember, tonight at midnight, the government shuts down. This isn't just about Obamacare now. This is the continuing resolution to fund the government. I know this is confusing to a lot of people, but they're tying the government shutdown to the issue of whether or not the House will willingly fund Obamacare. The people in the United States have very, very clearly and adamantly spoken out. They do not want Obamacare. They've made it clear. They've made it plain. They've been abundantly clear about it. The United States of America and the vast majority of people in the country have made it clear that they would like to see either it delayed or killed off completely. Now, I understand that there are some aspects of Obamacare that may be advantageous. One, you can allow your children to stay on your policy up to 26. It does offer continuing coverage if you have a pre-existing condition. And there are some benefits to that. What I am saying is that, as we have seen in so many previous instances, when you try to create a one-size-fits-all situation, it doesn't work. And it doesn't work for the same reason that they sell 2-bedroom and 3-bedroom and 4-bedroom and 5-bedroom houses. Because not all families can crowd into a 2-bedroom. And not all single couples need a 5-bedroom home when they have no children. And retirees don't need to buy a 5-bedroom home when they have retired and their children have all left the nest. You see, the idea of one size fits all is a government idea, but it's not an idea that requires or that is based upon individual preferences. And this is a country that is built upon liberty and freedom to make your own choices, freedom to do what's best for you, not freedom to follow a government mandate which requires that you buy a 5-bedroom house effectively, whether you have children or not. And that, ladies and gentlemen, is where the challenge is. You see, Obamacare is like saying nothing will be built but 5-bedroom houses from now on, and if you want a house, you've got to live in a 5-bedroom. And it doesn't matter whether you've got 10 children or no children. Everybody gets a 5-bedroom house. If you don't want to buy a 5-bedroom house, then you're just out of luck because that's all that there is available. And again, the example here is that it's so obvious why there is absolutely no reason or excuse for American citizens to be forced to buy things they don't want and be required by law to buy that. Because this takes the whole issue one step even further. If you look at the analogy I just gave you about the 5-bedroom house scenario, this isn't just a question of everyone has to live in a 5-bedroom house. It doesn't matter if you're a single person, and it doesn't matter if you're a brand new couple who just literally got married yesterday, and it doesn't matter whether you're a midlife family that is got young children and middle-aged children, adolescents, and it doesn't matter whether you're a senior and your children have all left the nest. Everyone must buy a 5-bedroom house. And furthermore, everyone has to buy a house. In other words, the goal here is that everyone must buy a house no matter what. It's not optional. And if you don't buy a house, you'll be penalized for not purchasing a home. So you must buy a 5-bedroom home. No more 2 bedrooms are available. No more 3 bedrooms. No more 4 bedrooms. Everybody gets a 5-bedroom house. And depending upon your situation, the government may help you out with the deposit, and in some cases they may not, depending upon your income. And so everyone has to buy a 5-bedroom house. In some cases, doesn't matter. If you need a little help, we'll help you with your down payment. That would be the subsidy part of this, right? And if you don't, because your income is too high, then, and all houses are priced the same, then you're going to have to buy it whether you like it or not. We're not asking you, we're telling you must buy this. Then to make matters worse, those people that are going to get a subsidy, and again, I'm hearkening this back to a discussion which I opened the other day, and I'm still doing research on this to actually get a hard and fast answer. If you are subsidized and they put you onto the Medicaid rolls, Medicaid rolls will require that any investment, any financial value that you have must be eliminated before you qualify for services. So when the way Medicaid works, unlike Medicare, which was for seniors, Medicaid says you've basically got to be bereft of assets. And so the question that we have, and we keep asking it, and I'm not getting answers, at least satisfactory answers, I'm getting a lot of I don't knows. And that's a dangerous thing. Because what the real question is this. If you are a family on Medicare, on Medicaid, excuse me. If you're a family on Medicaid, and you're on Medicaid because you qualify for a subsidy from the federal government, does that mean that all of your assets and all of the value that you have built up in property equity, 401ks from a job that you have, savings accounts, is that all open to being stripped by the government to help reimburse them for the subsidy they're paying you to utilize to buy this 5-bedroom house? See, here's the rub. If you're a family and you make $30,000 a year and you own a farm or a place that was given to you by your family and it's been handed down generation after generation, and you don't have a mortgage, are you disqualified? And if not, when you sell that house, is the equity captured as a result of your use of Medicaid? You get it? You're being forced to buy this insurance, which you may or may not have chosen or decided as your own family situation warranted, whether you wanted to buy insurance or whether your employer offered you insurance. But if you're a husband and you and your wife and 2 kids have a house on 5 acres of land that is all paid off, and let's say it's worth $100,000. Let's just throw a number out there. You got a little house on a piece of land and it's worth $100,000. You have no mortgage. You make, as a combined family, $30,000 a year. You work for an employer who offers you a somewhat, a basic health care plan, but it's nothing glamorous. Your company decides that because of Obamacare and they have more than 50 employees, it would be cheaper for them to just pay the penalty of $2,000 per employee than it would be for them to actually continue to deal with you and the health insurance issue. So basically the company says, listen, for $2,000 a person, we can wash our hands of the Obamacare disaster and it's not our problem any longer. Now you are thrown back out into the open world, into the shark pool, if you will, of insurance companies to find your own insurance. And as a result, you're required to sign up under the Obamacare exchange. Now, because you are a family of four and you only make $30,000 a year, you're below what they would construe to be the poverty line. And you may live frugally and you may live very comfortably on that $30,000 a year. Remember, you don't have a mortgage, right? So, you have a car that you own and you have, and you and your family, you and your wife have been frugal and wise about how you have, lived within your means. You live fiscally responsibly. You have no mortgage. You have 2 cars that are paid for. And you have a house that's worth $100,000 and a couple of cars that may be worth, $10,000 or $15,000 combined value. You're required to sign up. When you do, the requirement that you sign up comes with the fact that because you're below $30,000 or you're at $30,000, which is below the poverty line, you are automatically kicked onto the Medicaid rolls. Now you're offered a better job somewhere else, and you have to move. You're offered a job that will pay you $45,000 a year. And if you're willing to move 2 towns over, you can have the job. So you put your house up for sale, and it sells for $100,000. Do you owe Medicaid for the time that you utilize those services? Bingo. There's your rub. Nobody knows. Nobody's willing to say. The problem, ladies and gentlemen, is that we have been given limited opportunity to really understand the true issues surrounding the way that this project is working. And as a result, we have to decide how we're going to, we have to make an act or take an activity and spend money when we don't know the ramifications or the implications of that. That's a travesty. We're going to take a break. When we return, we're going to capture the second half of our program. We're going to talk about the NSA and the spying, how they have come out with a brand new Facebook-like interface that allows them to build a database on you, how Glenn Greenwald is about to drop another bomb on the NSA about how they have been utilizing and developing an assassination program. And we're going to talk a little bit more about some of the issues surrounding that. Ladies and gentlemen, we live in very, very dangerous and troubled times. I encourage you to please understand what is happening in America today. Wake up and learn how to fight back. We'll be back in just a moment.